And welcome back to the part 2 of our training manual. We left off at performance monitoring. So we did informal monitoring and formal monitoring. And so I'll just review some of those areas real quick. Informal monitoring looks like just spot checks. You're not in the area to do any formal type of assessment. You're just in the area. You might be grabbing maybe some paperwork, maybe you're checking on a student or a client, but you're not there specifically for observation. And in that environment, you're just looking at, how is the worker doing? Maybe there's something that you notice you would like to touch base on in more of a formal and structured setting. And then also we talked about the formal monitoring, which is more traditional in the sense of a meeting or observation that has a clear beginning and an end and a clear purpose of that observation. Now, there's some important areas to talk about for both of these. One main thing that I want to remind you BCBAs is that the less frequent the observation occurs, the more likely the staff will be reactive, and we call that reactivity. So as a supervisor, you're going to go in and you might see supervisees that are acting in ways that typically wouldn't be how they act on a day-to-day basis. Reactivity refers to staff altering that behavior, which will yield inaccurate data. So in order to decrease reactivity, you want to monitor frequently. So if it's an informal method, you might just be in the area where the supervisee is working frequently throughout the day for no specific reason. Just as I said, just in the area, maybe doing something other than, supervising the supervisee. So that should help. The more the supervisee is familiar with you being around, the more you'll see the true and accurate behavior that they display with the clients. As for formal monitoring, this might just mean instead of conducting a formal monitoring session once a month, maybe it's going to be every week. I know that can be a little bit more difficult. That's why this is more towards informal monitoring, just because it's not as structured and you can probably have a lot more flexibility with it. So definitely make sure, if you want to decrease reactivity, be in the environment more and have the supervisee comfortable with you being there. Another beneficial method to decrease reactivity is something called return monitoring, and what that looks like is monitoring that first time and then coming back at some point throughout the day. Maybe it could be a few minutes to an hour, and continue monitoring. So we talked a lot about monitoring in natural environments, such as going into a in-home setting and watching the supervisee and the child, or it could be going into a classroom and watching the supervisee and the child. But you can also conduct monitoring with one-to-one sessions, such as in an office or over Zoom. And that's also going to give you some understanding of where the supervisee's skill level is at. It also creates a great opportunity to talk more in depth about feedback without distractions, and can also be a good way to review diagnostic criteria. All right, so we are now going to be talking about part 3 of the manual. The next training is BST, Behavioral Skills Training. As supervisors to direct care staff, you will be using BST very frequently. So I really want to touch base on this, and we can talk about it, we can model BST, and we can rehearse it so we become more familiar with how to conduct it with our supervisees. So BST can aid our supervisees in ethical practice, as well as giving our clients effective and accurate treatment. So BST uses a six-step process, and I will demonstrate it right now. So first, we want to identify the skill. So for an example, you have a direct care staff, and you want the direct care staff to conduct a weight trial. So you can identify the skill, such as, I want you to present the SD weight and have the child wait for 20 seconds. And if they interrupt, you're going to say wait again, and you're going to be doing an error correction, so it'll be 10 seconds after. So you're going to identify that skill and also kind of give some background. This is going to help the child increase their duration for waiting. It might decrease subsequent requests, and it just can overall help them focus on what's in front of them, such as maybe playing with a toy, or maybe they're watching a video. And so really looking at one thing after another, instead of just, trying to access an item or activity that they are not able to have at that moment, which could also cause some increased behavior. So once you identify the skill, you're going to give them instructions on the skill. You can do this through a PowerPoint, you can do this through verbal instruction, whatever is the best method for your supervisee. In the in-home setting, you're likely going to be doing it with a verbal instruction, but if they request something written, it's also important to have a written, actually it will be written, now that I think of it, it should be in their program. So no matter what, it'll be written, and a verbal instruction will be paired. So back with the example of the weight trial, you'll give the instruction, okay, when you'll use it. Let's say the child's asking for, I want ice cream, I want ice cream, I want ice cream, over and over again. And you have to say, okay, wait. And they are to wait for 20 seconds without subsequently asking. So it's good to be as detailed as possible. If you just say, oh, you're going to just say wait, but you don't tell them the other circumstances, then the treatment plan is not going to be helpful. So if the direct care staff says wait, and the child keeps asking, and the direct care staff just says, okay, wait, it's not behavioral analytic practice. So really be as specific as possible with those instructions and have them understand the background of it too. Number 3 or step 3 for BST is modeling. So because you'll be going to homes with your supervisees, a really great way to show and teach these skills is to model the skill. So maybe you're watching the supervisee conduct it, and it's not bad, but it's not to our standards. You can say, hey, I'm going to show you how I do it, and let me know if you have questions. So again, do the model that skill, and once you model it, then comes step 4, which is rehearse the skill. And that is for the supervisee. So they will rehearse the skill. That can be role playing. In your case, it's going to be more than likely an in-home setting, so they'll be doing it with the client and you can observe it. So once you rehearse the skill, you progress to step 5 of the BST model. And what this is through delivering performance feedback. Now, performance feedback is something we talked about earlier in our manual, so make sure that you look back and you can really use those skills to help perform effective feedback for your supervisees. Again, this can be positive feedback, remember to be behavior specific, and also constructive too. So tell them what they did good with, and also make recommendations for improvement. And then lastly, that concludes step 6, or progressing to step 6 is our repeat steps 4 and 5 until criterion is met. So if they did not meet criterion after the rehearsal, that's okay. You can give the feedback, go back to rehearsal, then more feedback, still not met, go back to rehearsal. Maybe you have to model again, and then whatever will help the supervisee. and then feedback, and then you can finally discontinue, the training once you really feel that they understand the skill. So a few tips for BST is to make clear instructions and also to not make the instructions too wordy. These are supposed to be easy to understand, and you want to make sure that they can quickly implement the skill without having to read, wordy sentences and paragraphs just to understand how to conduct the intervention. So just make it as clear and to the point as possible. Lastly, a really big tip that we review with all our BCBAs is if there is a skill or an intervention that you yourself don't know how to do, or you don't feel comfortable or confident with performing it yourself, you should not be training a supervisee on it. Now, this is really important because you don't want to be training a skill that you can't accurately conduct, and therefore the treatment may be flawed. So really make sure that whatever you train, you do feel confident and you are getting it from behavioral analytic literature, and that you've taught this skill before. If you have not, you should seek supervision through one of our supervisors here that have conducted the skill. So another topic we'll be talking about in our manual is antecedent strategies. So a lot of times, I think as behavioral analysts, we always think of the consequence, and we are always trying to think of ways to use a consequence, to change behavior. That's what we do. But I think a lot of times, us behavioral analysis, we sometimes miss the antecedent strategies as well. So I really want to take the time to review antecedent strategies so that you can implement it with your own clients and also be able to be effective supervisors yourself. So the first antecedent strategy we will talk about is FCT, Functional Communication Training. This uses communicative behavior to compete with the problem behavior evoked by the MO. So in simple terms, you are trying to increase manding from the client. You want that appropriate response of manding, and therefore you're going to increase the alternate behavior and decrease the problem behavior. It is a form of mand training that teaches a child a specific kind of mand that results in positive reinforcement, such as access to toys, access to activity, attention, and even it could be escape too. Mands include vocal requests, manual signing, PECs, and others as well, but those are the main aspects of FCT. So I'm going to give you a quick example of FCT. You're going to still first teach the child to say, I want car, a toy car. I want car. Instead of yelling and kicking and trying to grab at the toy, you want them to say the request. If you see the child attempting to grab, such as reaching out with their arm, or that's a big one usually. If you see that, try to withhold the item. So if it's near them, just make sure it's out of their reach, because you want them to have the opportunity to mand. You can prompt using full verbal prompts, such as take the car away. I want car, and have them copy. I want car, and then you would give them the item. You could also use partial requests or partial verbal prompts, such as I want, and they would say, I want car. With FCT, it's really important that you use a continuous, dense schedule of reinforcement and make sure you reinforce that mand on every occurrence. it's best to obviously use very highly preferred items. That way that if they want it, they're going to do whatever possible and act in whatever behavior will allow access for that activity or a toy. Also, I mentioned this earlier, but you can gradually decrease prompts. So again, you can start off with a full prompt and then go down to a partial prompt. It's also important to use extinction, especially for the behaviors you don't want. So if the child is starting to cry, if they're starting to whine, you're not going to respond. But when they demand, you respond. You could also give them the card and also say, "Great job asking." And lastly, it's important to thin the reinforcement schedule. Also, for our antecedent strategies, we're going to talk about high Ps. This is really important, especially with the age group we're working with, the ones who are vocal. They're not always going to comply with some of the more difficult requests we're giving them. So using a high P strategy does help. So what the high P strategy involves is using 2 to 5 high probability instructional sequences. What that means is, in simple terms, easy requests. Requests that are in the child's repertoire, such as clap hands, very easy, or touch nose, or touch your head. Those are very easy for some children who have more developed language. So once you present those easier requests, you go in for the harder requests or the requests that they have more of a history of not complying with. So what this does is creates behavioral momentum, which increases compliance. So for a child that doesn't like social questions, or I guess in behavioral analytic terms, does not respond to social questions, you might benefit from using a high P. So again, you can say, "Okay, James, clap your hands, good job." And also it's good to praise them, be specific as well. So clap your hands, good job, that's great clapping. Touch your nose, awesome, that's touching your nose. And then you would go in saying, "What's your name?" And they would say their name. Lastly, you can also use an antecedent exercise. This could be very helpful for children who have a harder time sitting at their table. It is a longer session for some kids, so just making things more active and engaging for them in the beginning could help them comply sitting at the table. So a good way of doing this is maybe come in the room and give 15 minutes of the day just running around and having fun and doing jumping jacks and all those crazy things you can do with your body, dancing to music or playing with bubbles, something that really gets them active and engaged. And so this is a good way to kind of get their energy out, but also it helps them be able to comply with some of the other tasks, such as sitting at the table. Before I move on to the next part of our training manual, I will give a brief example of an antecedent exercise procedure. And you can actually incorporate this into the child's program as well. You don't even have to have them specifically sit at the table for this. But if you notice that a child really doesn't do well with, let's say, the social questions again, okay, well, why don't you put that into some of that antecedent exercising? So let's say you guys are running around the room, you're doing tickles, you're doing some, what do they call it, the bubble guns, the bubbles. And, you might be doing that. And then all of a sudden you can put the bubbles away and then deliver the SD, such as, "What's your name?" And then they will respond and you can say, "Great job." And you continue with play, or you can somehow transfer over to a table activity as well. But really getting, using exercise and using some fun activities in the beginning in order for them to want to keep doing those activities. So our next part we're going to talk about in our manual is TIP, which is Teaching Interactive Procedure. So this is mostly for children who are older in our program. This is not useful for kids that do not have a developed communication or language profile. So again, this is for older kids, but it is a useful area to discuss because sometimes with our everyday practice, we overlook some of these procedures. Especially when going to homes and working in the homes, we see a lot of children that do good, maybe in a one-to-one setting with their therapist, but their parents say that some of their more challenging areas is playing cooperatively and nicely with their siblings. So teaching interactive procedure is a really beneficial way to use with siblings and even incorporate with your own sessions, such as bringing a sibling into your session to have them practice this technique. So TIP can be used with, as I said earlier, sharing toys. So what you can first do is label the behavior that you want the child to work on, such as sharing toys with brother. The next step is you want the child to know why engaging in this skill is beneficial. Again, this is for older children in our program who have developed language and communication and who also have an understanding of maybe some type of emotion or emotional expression as well. So you can say something like, John, it's good to share it's good to share toys with your brother because mom and dad are happy. That makes mom and dad happy. And also you can say, John, it's good to share toys with your brother because your brother will share toys with you. The next step in TIP is to identify with the child when sharing toys would occur, such as whenever you're playing with brother in the living room, sharing toys should occur. This could also be implemented in other areas too, such as grandma's house or at school. But because you're in the home setting, you can really take time in the home to explain, hey, you're gonna go on break in the living room? Okay, that's when you play with brother. This is when sharing toys would occur. Now you also, again, depending on the child and how old they are and their understanding of time, you might be approaching this next step a little bit differently depending on the child. But for someone who does understand time, you might say, and again, let's maybe use video games since they're probably going to be older. So if you say, okay, sharing video games with brother, what that looks like is you have break for 15 minutes. So how about that looks like you have half of 15 minutes, which is roughly around 8 minutes. So how about 8 minutes of video game, and then you can let your brother play 8 minutes of video games. Now again, not everyone's going to understand time. So another way to do it is saying, especially with a video game, this could be a little easier. You can say, okay, once you finish the race on the race car game, it's your brother's turn now. You get a race and he gets a race. So something that they can understand, they have a really good understanding and picture in their head. You also want to be able to identify with the child not only when toy sharing would occur, but also what specific instances, such as if their brother keeps asking, hey, John, I want to turn with the game. I want to turn with the game. Or maybe they're, trying to grab the game from them. Or maybe they're trying to push them over. So those are indicators or even, SDs that toy sharing or talking about toy sharing might be the following step. Next, you want to model that behavior to the child. So this is a good time that you can, as a BCBA, you can be part of that model with the supervisee. Either you could be the child or the therapist, and you can model for the child video game playing. So have the child sit in break in the living room, and both of you can sit on the couch. One of you can be playing a video game, and the other one can say, hey, I want to turn, or I want to play. And the response for the other would be, how about I finish this lap and you can go next? Or I want to play for 3 more minutes and then you can play. And then also show them what they can be doing while the other person's playing. So you can either be watching and saying, oh, that's awesome, you're doing so well, be really excited watching the game with them, or you can walk away and play with something else. Show them that's okay to share toys, but you can wait your turn and then come back. So this next part is very similar to BST, where the child will be rehearsing as well. So now you will have the child, playing the video game, and this is something that you can do with them. You can say, hey, I want to play. And you're trying to get them to intervene themselves by saying, hey, 1 more lap, and then it's your turn. Or, hey, you can play with the video game if I can play with your electric, your toy car later on. So you want to have that dialogue with them, and you want them to understand that there's alternatives to what they're doing currently, and also that displaying certain behaviors, such as maybe shoving or getting upset, that there's other ways to go about that, and here are the replacement behaviors. And just as BST, you are going to use feedback with the child. So you can praise them. Great job. You did so good. Saying that you wanted to do 2 more laps. Or that was really great, using your words, saying you wanted to play a little longer. And that they could have a turn later on the day. So that was, just make sure that you're giving feedback. Or you can also say, that was great, but next time, why don't you tell them that they can play, after the game's done, instead of telling them to play tomorrow, So you want to teach those teachable moments. So with TIP, you can also use additional materials, such as some kind of picture handout, pictorial handout of maybe, or like a story of a kid sharing and how they can share. You can also use maybe some fun videos that you found online. I'm sure there's a ton of them. And you also want to collect data. This is also, with BST, I guess you can collect data with it too. But this is something you can definitely collect data with, and make sure that you are documenting it, such as rate. So, if you're going to be watching the siblings play with video games for 15 minutes, make sure you document, okay, they were fighting maybe 3 occurrences in 15 minutes. Okay, now it dropped to 1 occurrence. Or now I'm seeing the client speak up using their words instead of pushing or shoving. So data that is very descriptive in how progress is being made. And that concludes our 5 trainings for the manual. I hope that was helpful. I hope this can make you a stronger supervisor, and that you can use what we've talked about in your own trainings with your supervisee and the client. Because again, the better the supervisee is trained, the more effective the treatment will be for the client. And that obviously supports a client's best outcome, which is what we do our work for. So I hope you enjoyed it. Congrats on your new job. And I look forward to seeing you with more trainings.